director of programs at WHO Foundation. Emanuele, it is difficult to keep up on the range of restrictions. It is different for every country. And it seems like even in places where the restrictions are tough, it doesn't necessarily stop the spread, especially of this variant.
Yes, and I think we need to take this from the point of what needs to be happening. We need to get more people to be vaccinated, and we have different ways to make that. First, we need to ensure that vaccines are made available in countries and are available boosters for the older populations and vaccines for the younger population. And many parts of Europe are offering, but they need to accelerate the offering of vaccines. And then we need to bring on the side of the vaccines those that have been on the margin or again. And this has been done through engagement of community partly, and some countries have introduced these green passes that has increased that, and others are moving towards the mandate vaccines, which is really a last resort where everything else has failed.
You know, I find it really interesting what we're seeing going in China, especially in the last couple of days. You'll have a city where there will be a reported 10 or so cases, a handful of people testing positive, and then you'll see an entire lockdown of a city of 13 million people. I mean, it's just incredible from a Western perspective, the extremity of that. However, that's the sort of thing that works. If you're serious about stopping the spread, you can just shut everything down. It's the, I guess, economic concerns as well as the moral issues that prevent others in the world from taking those measures. I mean, China's an oppressive society compared to Western democracies.
Well, I think there is an epidemiological point that needs to be clarified. China is pursuing strongly a policy of zero COVID, so trying to reduce to zero the number of cases in the country. The majority of the world is not in such a position. So what we are trying to do, what the rest of the world is trying to do, is to reduce the number of cases, to contain the epidemic, and to manage the high number of cases, to bring them down, and to maintain a level of societal cohesion and support for the economy of the country. So it's a difficult balance, and it is at the end of the day a political choice that needs to put on the place a number of elements, starting from the epidemiological one and the science that tells us what is working at this point in time of the pandemic.
Right, and in some places it's tough to tell, and I'm glad you mentioned the politics, because I was just about to say, in so many countries, you see them trying to strike the balance politically, that things will change after protests, for example, or this government that's up for re-election will try to be all things to all people, but it's not necessarily effective. I mean, as the world, if you look at a perfect world, it should be based on public health. But our societies today are also based very much on economics and the way, you know, especially Western society is set up. People do not have an economic buffer. Many people have no buffer whatsoever. So measures are not about public health in all cases. It's really about, you have to keep the economy going as well.
Michelle, you say the world is not perfect. And I think what politicians all over the world are trying to do, some better, some worse, is to balance the public health needs to reduce the number of infections with the legitimate desire for people to continue having a life and making sure that people can earn their livings and continue living without major consequences, both on the economic side, but also, if you want, on the mental health side. So it is tricky, and it is the response that different governments are adopting are a reflection of the societal elements, the societal bonds that are present. So where the societies are strong, where trust towards government, towards scientists, towards health professionals is strong, there's probably not even need to bring in restrictions, because people will follow what is being suggested by the different type of authorities. Where that is lacking, then what governments are trying is to bring in more restrictions. That is not ideal, it's less than ideal. But again, it's striking the balance in a way that societies can remain functioning, and we can keep social cohesion while addressing the public health needs. That is the difficult task that I think many governments, many politicians have been trying to keep throughout the past 2 years, and we'll have to continue doing that. Some have done better, some have done worse. I think trying to do it to the best possible way, managing all the complexity, is a tough task for everyone at this difficult moment in time with the pandemic.
I know at times it seems like humanity is, doomed to flail around whenever there's a crisis. But hey, people do their best in many cases. And Emanuele, great to have you. Well put.